A trigger finger is one of the most common abnormalities that patients present to me with. A trigger finger is a type of tendinitis. We each have two tendons that go to each of our fingers and one tendon to the thumb. The tendon runs through a fibroosseous canal that keeps the tendon next to the bone. The best analogy I've come up with is a fishing pole. You can imagine how the fishing wire goes through the loops of a fishing rod. If a knot occurs in the fishing wire, it'll get caught in the rings of the fishing pole. Similarly, this happens or can happen in your finger. What happens from the tendinitis is the tendon gets inflamed and the nodule or knot that forms the tendon will get caught in the rings of the pulley system of your finger. Most cases of trigger finger are idiopathic, meaning we don't know what the cause is. On the other hand, patients with diabetes or rheumatoid arthritis are more prone to develop trigger fingers. Splinting or taping the finger at night is one effective way to try to treat a trigger finger. I can show you how to do that in the office. About 10 years ago, I actually did a study looking at trigger fingers. I followed patients for 2 years and found that 75% of people would be permanently cured with one injection. 2 injections cured 90% of people. In other words, 9 out of 10 people can be treated non-operatively for the trigger fingers. When non-operative treatment fails, surgery is a viable option. Surgery for a trigger finger is done as an outpatient. I do it under local anesthetic. I operate at St. Rayfield's, the Temple Surgery Center, Goose Lane, and Milford. The anesthesiologist is there to monitor you. You could be wide awake or a little sleepy. The surgery usually takes about 10 minutes. After surgery, you're in a bulky dressing for 2 days, and that soon after surgery, you start to get the finger moving. When non-operative measures fail, surgery is a viable option, but fortunately, most patients with trigger fingers can improve through non-operative measures. I look forward to seeing you for your trigger finger.